Retiring Today, the podcast through retirement. I am here with Richelle Smith. She's in AnnaMarie Morrow at Merkle. Whether this is or you've been on it for several, look at your plan each year. Talk about why revisiting your is a good idea and money and heartache. Richelle, AnnaMarie, famous info. This is Retiring Today, the podcast that guides you to and through retirement. I am Molly Nelson, host of the podcast, here with Richelle Smith. She's the producer of our podcast, and AnnaMarie Morrow. She is the director of Medicare at Merkle Retirement Planning. Whether this is your first year on Medicare or you've been on it for several years, you should take a look at your plan each year. Today, we want to talk about why revisiting your coverage and your supplements is a good idea and can save you a lot of money and heartache in the long run. Richelle, AnnaMarie, one of the most famous infomercials of all time. This ran a lot when I was a child. This is an infomercial from my childhood, and the tagline was, "Set it and forget it."
Put it in your showtime, then set it and forget it. In about 1 hour, the chicken is done.
Okay, so we just push play. We listened to the famous tagline, "Set it and forget it." You've heard it now too. A lot of people remember this. It was ingenious, right? You throw it in there. So you've tasted chicken from the rotisserie. Was it everything?
Absolutely. I remember this. Every Sunday after church, we'd come home to this. My mom was so excited about this purchase. And I think, it was definitely at least 2 handfuls worth of times we actually used it. But I do remember how tasty it was. But then Costco, had their rotisserie chicken come out and things kind of went that way. But I do remember this machine.
When it comes to cooking chicken, set it and forget it. A tagline many people remember and enjoyed. But Medicare, that's the last thing you want to do.
Yeah, do the opposite with Medicare.
Because a lot of people think I turn 65, I make my election, maybe choose a supplement plan, and then I'm off into the sunset. But no, each year they really need to revisit all of this.
Every year. I like to tell people, families that we work with, individuals on Medicare, think of it like you do meeting with your tax accountant at the beginning of the year. Meet with your Medicare agent at the end of every year between October 15th and December 7th. That is the annual enrollment period, and this is your opportunity to make sure that you are set up for success on whether it's the same plan or if you need to make a change to a different plan. This is your time frame to do that every year.
And I'm glad you said meet with your Medicare agent, because I think traditionally a lot of people work with a financial advisor, and then their Medicare elections, Medicare decisions, supplement stuff is in another building, another location. Maybe they have a rapport. But let's make it real clear. You are right here at Merkle Retirement Planning. You have
Yes.
a desk right next to the retirement planners. These are people you work very close with. And so that it's all right here for the families and individuals that we work with.
Yes, I am here full time. And Medicare, and a lot like Social Security, we have found too, people approach these decisions as a siloed, independent decision. But what's great about the process with a retirement planner, what we do here is there are no siloed decisions. So with me sitting right next to the retirement planners, it's a combined decision where we can look at your overall retirement plan and look at what you're comfortable with financially. As we talk about what you're comfortable with and what you want out of your healthcare, we can look at those other factors as well with the retirement planners. So it's an all-in-one holistic approach to the decisions you need to make, but they're guiding you to the decision that works best for you.
And you lead our Lunch and Learn every year around this time. And generally, a lot of the times at the Lunch and Learn, it is the families and individuals that we work with. Sometimes they bring a friend. But it's interesting to me, this is always a packed house, because even though we have helped these people set up a plan for Medicare, they are always kind of hungry for new information each year. And you always have new stuff to tell people about and a lot of important reminders each fall too.
There's a lot of excitement with a lot of new legislation that's wrapped around Part D that's coming out through the next number of years. And of course, we always get new numbers for Part B premiums, IRMA income limits and ranges. And hopefully we'll have some of that information by the Lunch and Learn this year. But yeah, people are thirsty and hungry when they come to these Lunch and Learns for all of this Medicare or all of this information on Medicare that just can affect their planning and what we need to be prepared for moving forward.
Yeah, and that's the stuff that keeps you busy year round. The legislation, we know this huge bill was passed inside the Inflation and Reduction that act, the Inflation Reduction Act. I think I said that right, but there was a big Medicare portion of that. And what was really interesting is, each year something changes inside that bill.
And it's good things too. The Part D program, the drug program, has always been just known as the expensive route. There's never been an out-of-pocket maximum on a drug card. And we're dealing with all these tiers, donut holes and copays and deductible phases. And that, some drug cards do cover some drugs some years and not others the other. And that's why we need to stay on top of it. Well, within this legislation, within this act, we actually start to see the implementation of an out-of-pocket max, where they're eliminating the catastrophic coverage tier. So there's exciting things on the horizon, and also the negotiation of prices for the expensive brand medications where there's not a generic option. We're going to see those costs starting to be negotiated over the next few years. Now, those costs that are being negotiated, we don't have those lists of those drugs yet, but once they're negotiated, those new cost changes won't be available for a number of years. But as the years go on, that's what we keep our families abreast of. That information as each year passes, we give those updates to keep you in the loop, and we stay on top of it as it unfolds. And if it changes any strategies that we've implemented, having you use, whether that's senior discount savings cards or using your drug card, there's so many different strategies that we look at to say what will work best within your retirement plan. And this is our opportunity every year to make those decisions together.
And that's our goal with this podcast, is to keep the listener in the loop. So what we want to do today is we're going to dive back into some of the legislation you were talking about, some of the changes, but I also think let's start at the beginning. Let's kind of go Medicare 101, because even that first initial, when you enroll initially, there are some guidelines, some timelines to be aware of.
Yes, that is the main question, is when do I have to elect?
Dun, dun, dun. There's an important window here.
There is an important window. I get phone calls and emails at least a year before people are turning age 65, because it is so overwhelming. You're starting to get all of this mail, and you're starting to pay attention to those infomercials that you're seeing on the television about electing Medicare, and not to mention all the Social Security letters you're getting letting you know if you don't elect, you're going to have a penalty. So just all this inundation, it's a great time to start planning ahead. When you're approaching that age of 65, know what the timeline is of enrollment periods. And so to kick that off, your first enrollment period, turning age 65, that's known as your initial enrollment period. And it's a 7-month window. It begins 3 months before your 65th birthday, and it continues through until 3 months after the month of your 65th birthday.
And so that's initially the first time I can enroll, and the deadline by which I have to enroll is what that 7th-month period is?
If you currently do not have qualified coverage, and what that means is if you are not on an employer group plan, if you are on an individual marketplace plan, or if you're on COBRA, those are not considered qualified. So you do need to elect Medicare within that initial enrollment period. But if you or your spouse is continuing to work on an employer group plan where there are more than 20 employees, that is considered qualified coverage. So you might not have to elect Medicare at age 65, which brings us to then a different enrollment period later on when you do retire.
And on the most basic level, elect Medicare means what? I just say, yes, I want Part A and Part B to start immediately, or what? Do you have to make any other decisions right away?
You need to choose. Well, if you are electing Medicare, if you don't have that employer coverage option and you are electing Medicare, then it's simply going to the Social Security website online and then electing Medicare A and B, the hospital insurance versus the doctor's insurance. But if you're not electing Medicare at age 65 because you or your spouse is continuing to work and you will be on that employer group coverage, then you have the decision to make, do I elect just Part A or not? Because you do not have to elect both at the same time. And a part of that decision making is, and this is why I work right next to our retirement planners, is we look at the cost analysis. We do a cost analysis of what income is if you have that option for employer coverage. What would it still be a good idea to do your spouse's coverage or stay on your own? What's more cost effective within that area? Or then if we're doing Roth conversions, if there's strategies we're implementing within your overall plan to where we might say, hey, if you have this employer group option, let's take advantage of that so we can implement these other strategies within the investment plan that will also guide us to making that decision on when to elect Medicare.
Is it common then to be 65, continue working, not use the group coverage, and then go ahead and elect Medicare?
It is. It's probably, I'd say, 60-40 split, maybe even 50-50, because we like to get together, look at that cost analysis. Are your monthly premiums on the employer plan what you're responsible for paying? Is that higher or lower than the Medicare premium? What are you paying for medications on the employer plan versus what are you going to be paying for your medications on Medicare? So once we have that cost analysis put together and we can review it as a part of your overall retirement plan, that's when we can really be guided to that decision. When do we elect Medicare?
Some of those Medicare flyers that people get talk about penalties. Are there penalties for not electing Medicare if you're not on a qualified plan?
Yes, there is a penalty. Let's say you're on just the marketplace, an individual marketplace plan on healthcare.gov. You turn 65, but you're like, no, I'm getting this, subsidy, this huge savings on the marketplace. I don't want to elect Medicare at this time. You will have a Part B penalty when you do go to elect Medicare Part B. And you'll have this penalty with your monthly premium throughout the duration of your lifetime.
Is there ever a scenario under which people stay on their marketplace coverage and don't elect Medicare and pay the penalty on purpose because it's so much cheaper to be on the marketplace, or is that generally not the way it goes?
I haven't seen that. I haven't seen people, I have not met a person who is paying that Part B penalty. I will tell you though, I have had clients working with refuse to elect a drug card. So a drug card, if you don't elect a Part D drug card within a certain amount of time of electing Part B, I think it's like 63 days, if you go without coverage, you will then have a Part D penalty when you elect a drug card later on in life. But there are people, these clients I'm thinking of, they don't take medications, they're healthy, they don't foresee ever having to do that. So why do I want to pay a monthly premium for something I don't need? There's all these other models I can use. If I do start accumulating medications, I'm not going to pay that. So I have seen that option. I haven't seen it go to where they have waited and then they do elect and then they do have the penalty, but I know people who are refusing to elect.
How much do you pay for the Part D?
So Part D, it's based on how many months you go without coverage, not years. So just months. So let's say 20 years down the road, so you're 85 years old and you start accumulating these medications and you're like, okay, I need to look at a drug card. So you go to elect a drug card, you will have incurred a 1% penalty for every month you went without coverage. And that 1% is times the national average for a drug card premium. I think this year it's around $32 or $33. So you times 1% times that, and then times how many months you went without coverage, and you have that penalty attached to your monthly premium throughout the duration of your lifetime.
So essentially, you'd still be saving if you didn't elect and you didn't take. I'm just thinking.
Theory.
Yes,
in theory.
It's interesting.
But no one likes that word penalty.
Correct. No one wants it because when you first see it and you don't understand exactly what it is, and generally most people at some point in retirement are going to take some type of a medication. So generally, what you see though is most people go and elect and pay the Part D.
Oh yeah,
monthly.
Absolutely. It's less than a handful of people that are putting up that stalwart wall of, no, I'm not going to elect that, because it's a pretty seamless process. Once you get your A and B in place, there's plans out there that combine drug coverage with the health benefits where there isn't a separate premium. So that's become a popular option. So that's always something that we want to talk about. What you're comfortable with, what your overall retirement plan for shows that you can, afford and offset expensive costs in the long run as well.
So in that case, when they're using one of those plans where the drug coverage is included, do those people not elect Part D then?
That's a great question. So those plans, what I'm thinking of are the Advantage plans. So Advantage plans have a drug card. Not all of them, but the majority of Advantage plans have a drug card built into them already. So there is no separate premium when electing Part D. It's already within that plan.
So those people aren't paying no penalty for those people.
Well, if they had waited and didn't elect a supplement and they're outside of that window and then they elect their supplement during annual enrollment, then yeah, they could have a separate bill for a penalty.
We've kind of just been focusing on initial enrollment, but it's not a set it and forget it type of thing. Each year you're revisiting Medicare with the families and individuals that we work with, and you go through a checklist of things that they need to look at each year. So let's just go through that checklist. First thing is supplements.
Supplements. This is it's also known as Part C, and this is what fills in the gaps of original Medicare. So when you go to the doctor, this is what is going to dictate what your copays are. If you're on an Advantage plan, what your out-of-pocket max is, or if you're on a traditional Medigap plan, we review, what those copays are, what your out-of-pocket max is for the year there. And the basic question every year is, are you happy on your supplement? Do you want to make any changes?
What kind of things can happen that might make people change supplement plans?
Cost. So every year on a traditional supplement plan, you can face around 2 increases every year for your monthly premium. It's based off of age and inflation. So a lot of times when people get to that age where they're paying over, $200 or sometimes $300 a month for their supplement, for whether that's Plan F, Plan G, then let's have a discussion. Is there a different carrier that we need to look at for a lower cost? But if we do that, there will be underwriting involved. Or do we look at an Advantage plan versus what the out-of-pocket max is for the year versus what you're paying for monthly premium for the year? Because these Advantage plans, a lot of them have either $0 or a very low monthly premium cost. So if you're not happy with your supplement plan, whether it's expensive or if you don't like the copays you're paying, let's take a look at that and measure out what your options are, if there's underwriting or what could be a better fit for you.
The next thing on the annual enrollment checklist is doctors and specialists. Are you looking to see if people are still in network here each year?
Yes, this would apply if you're on an Advantage plan. If you're on a traditional Medigap plan, which would be a Plan F or a Plan G or a Plan K, all the letters, then your doctors they just need to be contracted with Medicare. You have basically an open network as long as they've contracted with Medicare.
Are most doctors generally contracted with Medicare?
I had a girlfriend of mine who is a doctor, and I asked her that question. She's like, honey, if we didn't contract with Medicare, no one would be making any money.
So
But yes,
it's in their best interest to do it, and they generally do.
Yeah. Unless you're a pediatrician, then it would probably be in your best interest. But then, so that really applies to the checklist where people are on Advantage plans, because these are networked plans. Advantage plans, it's either an HMO or a PPO network, which means that on an HMO, if you go out of network, you're liable for 100% of the cost. PPO, you can still go out of network, but you could pay a higher share of the cost. So this is where every year doctors have that option, whether to contract with that plan the following year. And we have seen it to where they opt out and people didn't do their due diligence of making sure they're in network, and all of a sudden they're paying such a higher cost to go out of network. So this is absolutely a part of that checklist process.
So tell me, what are you doing then with the families and individuals? Are you taking a look at their doctors? Are they giving you a list of those, and then you're cross-referencing that to make sure it's still within network in their plan?
Yes, with that due diligence process, at the beginning of annual enrollment, we do this fact-finding research. With families that we work with, we request this information that they're willing to share with us to make sure that, we can look at what any network changes are for the upcoming year. And then also, which I think is coming up next, is the drug coverage as well.
And then, so if you find that the doctor that they use is not still part of their supplement plan, then they have 2 options. They can continue to go and just know that there's some out-of-pocket costs coming, or maybe you'll talk to them about, hey, do you want to look at changing to a supplement plan that your doctor is contracting with?
Exactly. Just setting people up for success in the next year, whether that's giving them the knowledge that, hey, your copay could be this, your new out-of-pocket max could be higher due to going out of network, or let's find you a plan that can fill in that gap.
Setting them up for success, and then also trying to eliminate surprises.
Yes.
And that leads us into the next part of the checklist, which is your pharmacy, checking if your pharmacy is in network. And I know you've heard some heartbreaking stories when it comes to this.
Oh, yeah. I mean, just like what you said, just the surprise factor. And you wouldn't think pharmacy, right? You would think when people think pharmacy, I mean, it's how I thought of pharmacies before I dove into Medicare years ago, is, it's a pharmacy. I can just pick up my drugs. They're going to cost the same everywhere, but that's
give
not
them my
the
drug
case.
card, and yeah.
Exactly. So pharmacies do contract with a preferred or standard or not at all with drug card carriers, and that affects pricing. I mean, what was that? That example, like a simple medication I had pulled up for a client that I work with. It was a generic.
I think it was an arthritis medication. I have some of those numbers here in the outline. Yeah, it's meloxicam.
Yeah.
Is that how you say that? Yeah, you pulled that up for a client. You were doing the research, and yeah, go ahead.
Yeah, it was in an in-network pharmacy. It was a $12 copay, which is pretty standard. But then they wanted to go to their regular pharmacy out of network. Guess how much the copay was? I mean, you know, Molly, because you're looking at it. Richelle, producer Richelle, do you have a guess?
Oh man, $300?
Not even close. So $1,117 for a generic.
If you went to pick up your prescription and that came up, that you would have to say no.
Yeah.
Most
Oh, yeah.
people would have to say no,
Yeah.
and then imagine having to pass on your arthritis medicine that you've probably been taking for a long time and is helping you. That's not the decision I want to have to make when I'm at the pharmacy.
No, those are the most heartbreaking phone calls I'll get is at the beginning of the year. Families who, didn't have this information that we're not working with, they'll call me and be like, why did this happen to me? I got my 90-day refill in November and I paid $12, and then I go 90 days later into the new year and now I'm expected to pay thousands. What happened? That's scary.
And that's what you're trying to avoid. So same thing, I'm assuming, with the doctors. You do this kind of cross-referencing, and then what decisions do people make if you tell them about this? Hey, I just looked at this meloxicam, and I found this out. Do you find that they switch pharmacies, or do they end up generally switching supplement plans?
No, it would definitely go pharmacy. I mean, depending on where you live. I mean, we look at what pharmacies are available in that area. A lot of rural places in Iowa, it's hard to navigate that. But then a lot of times what we've found in rural Iowa is these pharmacy owners who are out of network, they don't want to lose business. These are mom and pop pharmacy stores. So a lot of times, in some cases, we have found maybe a simple discussion. Hey, how can we navigate this cost if, one of the major pharmacies is not available? It's hours drives away. Maybe it can come down to just a simple conversation.
Okay, and the pharmacy owner may be willing to add that to their network. That's really helpful to know that that's even a possibility, especially if you live in a community, maybe there's just one or two pharmacy options. A big thing that I've seen happen a lot of times with people who haven't taken part in this due diligence during annual enrollment is medications. Medications is a hot topic every year within Medicare because they can be so expensive. So I would say what keeps annual enrollment the busiest time of year is checking medications. Supplements, on average, people are comfortable with where they're at, as long as there hasn't been a huge blow up in cost. So that we don't see a lot of change with, but it's the drug cards that we see a lot of change with, because even if your medications have not changed, drug cards, whether it's a standalone drug card or a drug card within an Advantage plan, those plans can and do change the medications they cover every year. So, we're talking about meloxicam, for example. Let's say it is covered on a standalone drug card 1 year, but then you go get it refilled the following year and it's no longer covered. You could also see that $thousands difference. So that is probably the biggest, task finder during annual enrollment, is to make sure your medications are covered the following year. And by no fault of the consumer, think of the set it and forget it. The big draw is you can put it in, you don't have to do anything. We love slow cookers because the food cooks all day. We like the convenience of going to our pharmacy and getting that medication we've been on for several years from the pharmacist we know by name. Why would we assume any differently from December 31st of 2023 to January 1st of 2024.
Exactly. And that is why, we want to put it on your calendar, just like you do your tax accountant. Just be prepared. You're doing that at the beginning of the year. Make sure you're doing it at the end of every year.
AnnaMarie has been giving us some great information about Medicare, but you might have some questions about your specific situation. Well, you're in luck. You can talk directly with AnnaMarie by scheduling a 15-minute retirement checkup call. You can go to merkleretire.com. That link is in our show notes. Merkle is spelled M-E-R-K-L-E. There's a calendar there, and you will fill in some information in order to schedule this call. In the notes on that part, just make sure you put Medicare, put AnnaMarie, put supplement, put Part A, put Part B, put just about anything that will indicate that you would like that call to be with AnnaMarie, and you will get to talk about Medicare and get some of your questions answered. You can get a lot accomplished in 15 minutes, AnnaMarie.
Yeah, a lot of feedback I get before, having that conversation one-on-one with people is, I am so confused. I'm so overwhelmed. I don't know where to begin. And then, but the great news is that after spending 10, 15 minutes with someone, just streamlining information that only pertains to their situation, the feedback is, oh, well, that was easy. And that honestly is just like the big winner of my day.
Yeah, and this is a call that you can schedule no matter where you live in the country, and you can have a conversation about Medicare. Or if you've got other retirement questions on your mind, go ahead and schedule a retirement call, and you'll talk to one of the retirement planners.